To the class. So today, like I mentioned earlier, we'll be looking at the procedure of CPR. We'll be looking at what is involved when you carry out CPR, and most importantly, how to carry it out, what to note when you are carrying it out. It's not just enough for you to do what you're supposed to do, you have to do it right for it to produce the expected result or the expected effect. So now, yes, let's look at the components of CPR. We actually have two components of CPR. We have the chest compression or hands only CPR. Then we have the rescue breaths, also called ventilation, and also called mouth to mouth CPR. Those are the two components of CPR. You can't just do only hands only CPR or do only mouth to mouth CPR. You have to do the two for you to ensure 100% effectiveness. So yeah, now let's look at the first one, the chest compression or the Anthony CPR. We'll be talking about each of these components extensively in the next video clip. I just want to introduce just briefly to it now. So looking at the chest compression, so this is the most important component of CPR. If you remember, we earlier mentioned that one major thing that occurs when an individual experiences cardiac arrest is that the heart stops beating, and once the heart stops beating, blood does not get pumped to the parts of the body, and once blood does not get pumped to the part of the body, some body organs start to die, especially the brain cells, and it is when the brain cells die that the person might enter coma or even die. So it is the most important part, because it's not just enough for the person to still be breathing, or even if the person is still taking in oxygen, and the blood to transport the oxygen to the parts of the body, to the organs in the body, is not moving, then the oxygen the person is taking in is more or less useless. So this is why hands only CPR is the most important component of CPR. The blood needs to flow. So if the blood is flowing, then any oxygen coming in then can get into the blood and get transported to the parts of the body that needs the oxygen. So what chest compression does, that it helps to make the heart pump blood, artificially helps to make the heart pump blood. Remember I mentioned earlier that the CPR does not restart the heart. Yeah, it's just like maybe you are trying to, I'm coming now. Okay, maybe you are trying to, the car is not moving, but there are sometimes if you push the car, if you set the chair well and everything, and the handbrake and all, you set it well, if people push the car will actually move. So it's like that pushing is like an artificial way of making the car move. But that does not mean the car has started. It is only when the ignition comes on and the car is able to start heading, that's when you can say the car has started working again. The fact that the car is moving does not mean it has started working again. So what chest compression does is it artificially helps the heart to pump blood. Normally you don't need any form of external influence for your heart to pump blood. It pump blood on its own. It's an autonomous process. It happens on its own. It's an involuntary process. You don't need any external influence. But when you what chest compression is going to do, it's going to help the heart to pump blood. But it's not like it's not going to restart the heart to start it to work again. By the time we continue in this training, I was saying there's one of the video clips that will address what makes the heart to restart. So that once a person is revived with CPR, the person needs to get that thing early enough so that the heart can start its work properly. So hands only CPR or chest compression is going to help keep the heart alive till a defibrillator is available. So it is the defibrillator that restarts the heart, not the hands only CPR that you are trying to carry out. Then the second component is the rescue breath or ventilation or mouth to mouth CPR. So what this does is it helps to supply oxygen to the bloodstream. If you remember when we're talking about assessing patients, we said after you've checked for consciousness, then the very last thing you check for is if the patient breathing. How you have to look at the patient nostrils, do we have air coming out, or can you feel air coming out from the nostrils, and look at the abdominal region. Do you have is there any movement that indicates that the patient is breathing? So once you check that and see that the patient is not breathing, then that means it is actually important you carry out mouth to mouth compression or mouth to mouth CPR, because it helps to supply oxygen to the bloodstream. Okay, so now let's imagine the heart starts pumping, blood starts flowing, but the patient is not breathing in. The patient cannot breathe in on his or her own. Then you are the one that's going to supply the oxygen. And how do you supply the oxygen? You supply the oxygen via mouth to mouth CPR. But so many people might have so many restriction or reservations as regards mouth to mouth CPR, I'm actually going to send you an image that shows how you can carry it out without having to put your mouth directly in the person's mouth, because I know there could be transmission of some sorts of infection, or this transmissible and communicable infection through that process. But if you know you have some reservations, it's either you don't carry it out at all, but it is advisable you carry it out just to increase the patient chance of survival. So either you don't carry it out at all and do only chest compression, or you can actually make use of, there's something you can put in your mouth, then also put in the patient's mouth, then through that, will I call it medium now, and you'll be able to blow air into the person's mouth. We'll look at the process one by one after this video clip. Please, let's ensure we pay rapt attention, because this part is the most important part of the training. Thank you.